Hello my MedEd fellows, today we are going to talk about thanatophoric dysplasia, a rare genetic disorder that affects bone development. So, what are the clinical features of thanatophoric dysplasia? Well, patients with this condition often present with rhizomelic shortening, which means that their limbs are shorter closer to the body. They also have a small chest and an absent sciatic notch. One important thing to remember is that thanatophoric dysplasia is inherited in an autosomal dominant manner, which means that if one parent has the condition, there is a 50% chance of passing it on to their children. The underlying defect in thanatophoric dysplasia is a mutation in the FGFR3 gene, which leads to abnormalities such as platyspondyle, or flattened vertebral bodies. Now, what is the most common cause of death in patients with thanatophoric dysplasia? It is pulmonary hypoplasia, which is underdeveloped lungs. This can lead to respiratory failure and ultimately, death. One characteristic feature of thanatophoric dysplasia is the presence of French telephone femurs, which are curved like a telephone receiver. Patients may also have H-shaped vertebrae and a cloverleaf skull, which is a severe form of craniosynostosis. There are two types of thanatophoric dysplasia, type 1, which does not have a cloverleaf skull and is associated with telephone receiver femurs, and type 2, which does have a cloverleaf skull and straight femurs. To remember these important points for your medical exams, think of thanatophoric dysplasia as a rare genetic disorder that affects bone development, with features such as French telephone femurs and a cloverleaf skull. And remember to like, share, and subscribe to